So blood is going to be a more fluid tissue that has many tons of chemicals that are dissolved in it, and then millions upon millions of cells that are floating within it. The liquid part is called plasma. It's suspended up into the plasma, or suspended up in the plasma are going to be many different types of cells and fragments, which will then make up the formed elements of blood. Hematopoiesis is known as the formation of new blood cells, and we'll talk about that here in just a couple of minutes. Wrong way. Blood plasma is the liquid part of the blood, or blood minus its formed element. So your plasma is going to make up about 55% of whole blood. It consists of water with many substances that are dissolved within it. All of the chemicals that are needed to stay alive, your nutrients and oxygen, for example, these have been brought to them by the blood. The amount of your blood will vary with how big the person is and whether they are male or female. So a larger person is going to have more blood than a smaller person, and then a man is going to have more blood than a woman. But as a general rule, most adults will have between 4 and 6 liters of blood throughout their entire body, which will account for about 7 to 9% of your total body. There are 3 main types of subtypes of formed elements. You have red blood cells, white blood cells, and platelets. So your white blood cells are also going to be further broken down into granular leukocytes and agranular leukocytes. It's difficult to understand how many blood cells and cell fragments there are within the body. So for instance, you have 5 million red blood cells, 7,500 white blood cells, and 300,000 platelets that will occur within 1 cubic millimeter of blood, which is just essentially a fraction of a drop. So keep in mind that these are going to be considered our normal count. So because red blood cells, white blood cells, and platelets are continually being destroyed, then the body must continuously make new ones in order to take their place. You have a few million red blood cells that are manufactured every second. As we mentioned a few minutes ago, that hematopoiesis is the formation of new blood cells. You have 2 different kinds of connective tissue. You have your myeloid tissue and your lymphoid tissue. And these will make blood cells for the body. The myeloid tissue is better known as red bone marrow. And then in the adult, it's found chiefly within the sternum, the ribs, and the hip bones. A few other bones, such as your vertebrae, clavicles, and your cranial bone, those will also contain small amounts of that important tissue. The red blood cell, which is surrounded by a tough and flexible plasma membrane, it is caved in on both sides so that each one has a thin center and thicker edges. The biconcave disc shape will provide a large surface area for removing dissolved blood gases and other solubles that are quickly in and out of the blood. It also helps keep the red blood cells from spinning as they flow through the bloodstream. The complete blood cell count is a battery of tests that's used to measure the amount. And the amounts are the levels of many of our blood constituents, and it is often ordered as part of a physical exam. Measuring the numbers of circulating red blood cells per blood volume is a valuable part of the CBC. Values listed within the CBC will normally slightly vary among labs in reference tests for the red blood cells that are arranged anywhere between 4.2 and 6.2 million per cubic millimeter of blood. And then with males, they will generally have a higher number than females. Normal deviations from the average ranges will also occur with different ages, the level of hydration, altitude of residence, as well as other variables. The hematocrit component of the CBC that will provide information about the volume of red blood cells in a blood sample. If whole blood is placed, if whole blood is placed into a special centrifuge tube and then it's spun down, then the heavier and the formed elements will quickly settle into the bottom of the tube. So during the procedure, red blood cells are then forced to the bottom of the tube first. The white blood cells and platelets will then settle out in a white colored layer called the buffy coat. The hematocrit test will then give the example of the proportion of the red blood cells to whole blood. Normally, about 45% of blood will consist of red blood cells. The hemoglobin molecules that fill the millions of red blood cells are critical in the transport, which is an exchange of oxygen and carbon dioxide between the blood and the body cells. They also play a key role in maintenance of acid-base balance within the body. And hemoglobin is a quaternary protein that is made up of 4 folding polypeptide chains. There is a chemical structure called a hemigroup that's embedded within each of those folded chains. An iron atom within each hemigroup will attract oxygen molecules to unite with the hemoglobin within this form, and an oxygen hemoglobin complex called oxyhemoglobin. Iron is going to be an essential nutrient that's needed to give hemoglobin its oxygen, carrying its ability of vitamin B12 and folate are also critical among nutrients that are needed by the red bone marrow in order to manufacture enough. The term anemia is used to describe the number of different diseases that is caused by an inability of the blood to carry sufficient oxygen to the blood cells. An anemia can result from an inadequate number of red blood cells or a deficiency of normal hemoglobin. The term pernicious anemia, that is used to describe a deficiency of red blood cells that results from a failure of the stomach lining to produce its intrinsic factor, which is a substance that allows vitamin B12 to be absorbed from the foods that we eat. Our blood types are going to be identified by certain antigen molecules on the plasma membrane surfaces of our red blood cells. An antigen is going to be a substance that can stimulate the body to make antibodies, and almost all substances that act as antigens are going to be foreign molecules, meaning often on the surfaces of bacterial cells and viruses. That is, they are not the body's own natural molecules, but instead they are the molecules that have entered the body from the outside by means of infection, transfusion, or some other method. The word antibody can be defined in terms of what causes its formation or in terms of how it functions. Defined the first way, an antibody is a substance that's made by the body in response to stimulation by an antigen. Defined according to its functions, an antibody is a substance that reacts with the antigen that stimulates its formation. So every person's blood is one of the following blood types within the ABO system of typing. So suppose you have type A blood. The letter A stands for the certain type of energy in the plasma membrane of your red blood cells that has been present since birth. So because you were born with type A antigen, your body does not form antibodies to react with it. In other words, your blood plasma contains no anti-A antibodies. It does, however, contain anti-B antibodies. So for the same unknown reason that these antibodies are present naturally, the type A blood plasma and the blood will not form in response to the presence of the type B antigen. They are simply part of the body's genetic makeup. Similarly, in type B blood, the red blood cells contain a type B antigen, and then the plasma contains anti-A antibodies. The type AB blood is in its name indicates that the red blood cells contain both type A and type B antigens, so they contain neither anti-A nor anti-B antibodies. The opposite is true of type O blood. And that is where your red blood cells contain neither type A nor type B antigens, and its plasma contains both anti-A and anti-B antibodies. So it may make you think of the O as a 0. I hope you remember that type O blood has 0 A or B antibodies. You may be familiar with the term Rh positive blood. It means that the red blood cells of this type will contain the antigen called the Rh factor. So it's essentially going to be your positive or your negative. So AB negative, type O positive, type O negative. That's really all you need to know as far as that. I'm not going to read through this whole paragraph here because the biggest thing to think about whenever you have your typing is the universal donor and the universal recipient. So who can receive and who can give. Your universal donor is your type O, Rh negative. So they have 0 antibodies and they have 0 Rh antibodies. And then your type AB, Rh positive, they are the universal recipient because they basically can receive anything because they have they don't have the antibodies, the anti-A or anti-B antibodies. So if you recall your white blood cells, these are also called leukocytes. Different types of the white blood cells are categorized by the presence or absence of stained granules in the cytoplasm. Your granular leukocytes have stained granules and agranular leukocytes do not. The granulocytes include neutrophils, eosinophils, and basophils. The lymphocytes and monocytes are going to be known as agranulocytes. All of the white blood cells are involved in immunity. However, each type and some of the white blood cells has its own unique roles to play within the immunity, such as phagocytes of foreign particulates or virus-infected cells. Normally, the number of white blood cells per cubic millimeter of whole blood ranges anywhere between 5,000 and 10,000. So the term leukopenia is used to describe an abnormally low white blood count. And while leukopenia does not occur very often, malfunction of the blood, forming tissues and cells, and some diseases affecting the immune system, such as AIDS, may lower the white blood cell numbers. Neutrophils are the most numerous of the active white blood cells called phagocytes, which will protect the body from invading microorganisms by taking them into their own cell bodies and by addressing them with a process of phagocytosis. Eosinophils, these will also serve as weak phagocytes. Perhaps the most important function involves protection against infections that are caused by a certain parasite and parasitic worms. They are also involved in regulating allergic reactions, which are including asthma. Eosinophils in peripheral blood and related mast cells are found in the tissues. They will both secrete the chemical histamine, which is released during your inflammatory responses. Basophils will produce a potent anticoagulant called heparin, which prevents blood from clotting as it flows through flows through the blood vessels of the body. Monocytes are the largest leukocytes, and these will help protect us against infection, but they do it by a process different from phagocytosis. Lymphocytes will function in the immune mechanism and the complex processes that make us immune to infectious diseases. Leukemia is the term that is used to describe the number of blood cancers that are affecting the white blood cells. Almost every form of leukemia, marked leukocytosis, occurs. Leukocytosis counts in excess of 100,000 per cubic millimeter, and circulating blood are common. Therefore, many of the additional white blood cells do not function properly. The different types of leukemia are identified as either acute or chronic based on how quickly symptoms appear after the disease begins. Leukemias are referred to as lymphocytic or myeloid, depending on where the disease develops within the body. The platelet, which is the third main type of formed element, plays a central part in blood clotting or in coagulation. A clot plugs up torn or cut vessels and stops bleeding, otherwise that might prove fatal. Platelets are also called thrombocytes, from thrombus, meaning clot. So the story of how we stop bleeding when, hang on, I'm trying to figure out where this is. I don't know what that paragraph is saying. So the story of how we stop bleeding when Andrea curses is the story of the chain of rapid fire reactions. All of these reactions will accumulate in the formation of a blood clot. So when an injury occurs, smooth muscles around the wall of the vessel, reflexivity contract, and then will reflexively contract, and therefore, sorry, my dogs are going to go crazy here in a second. And therefore, they will constrict the diameter of the vessel, a process called vasoconstriction. The resulting pressure will help temporarily close any gaps in the vessel wall, and it will reduce any local blood flow until other measures come into play. Pressure applied from the outside of the wound by a first respondent will often enhance this effect. As our vessels constrict, damaged tissue cells release various clotting factors into the plasma, and these factors rapidly react with other factors that are already present in the plasma in order to form prothrombin activator. Normally, the lining of blood vessels are extremely smooth, but an injury makes a rough spot with exposed collagen fibers. This attracts the platelets to the site, which will then become sticky at the point of injury, and they will rapidly accumulate near the break in the blood vessel, forming a soft temporary platelet plug. As the platelets accumulate, they release additional clotting factors that form even more prothrombin activator. If the normal amount of blood calcium is present, a prothrombin activator will trigger, and then the next step of the clotting by converting the prothrombin to thrombin. In the last step, your thrombin will react with fibrinogen to change it to a fibrinous gel called fibrin. Under the microscope, then that fibrin, it looks like a tangle of fine threads with red blood cells caught in between that tangle. Unfortunately, clots sometimes form and unbroken blood vessels of the heart within the broken blood vessels of the heart, brain, lungs, and other organs. Adrenaline may produce sudden death by shutting off the blood supply to that vital organ. When a clot stays in place that is formed, it is called a thrombus, and then the condition is spoken of as a thrombosis. If a part of the clot dislodges and then circulates through the bloodstream, the dislodged part is called an embolus, and then it is a condition called embolism. So for example, a clot fragment that lodges in the lung is known as a pulmonary ism, which is a situation that can be fatal. So pathology of the blood system, you have your blood clotting disorders. So if you are hypercoagulable, it means that your blood has a increased tendency to form the clots. You have factor V, Leiden, your deep vein thrombosis, which is where it's down in the legs typically, or your pulmonary embolus, which is in the lungs. Your blood clots in your arteries, those can cause stroke, heart attack, and then even loss of limb. And then your bleeding disorders, so your hemophilia is where your blood clotting factor is missing. So you can have spontaneous hemorrhaging. And then what's known as von Willebrand's disease. It is genetic. It does happen mostly in females. And it's where you have a low level of that clotting protein called the von Willebrand factor. And it can cause heavy bleeding and hemorrhage. Leukemia, which is a cancer of the blood system. You have your increased abnormal leukocytes that will impair the ability of the bone marrow to produce those red blood cells. And then you've got 4 different types that are listed: acute myeloid leukemia, chronic lymphocytic leukemia, myeloid, and then lymphocytic leukemia. Your lymphomas, which are malignancies of just lymphoid tissue. So you've got Hodgkin's lymphoma versus non-Hodgkin's lymphoma. So essentially, it's just a cancer of the immune system that is based on different cells where your body just has trouble fighting infection. So if it is Hodgkin's, then it does affect that Reed-Sternberg cell. If not, it is just classified as non-Hodgkin's. Your multiple myeloma, that is going to be a genetic material in plasma that mutates and the cells become cancerous, and then they will then multiply and then grow those healthy cells. And then it causes abnormal proteins that do have complications. So typically you will develop more than one lesion, and that is what will cause you to be tested and diagnosed. But decompression sickness, also known as the bends, I'm not going to lie, for the longest time, I thought it was BENV and not the BENDX, like a Mercedes Benz. But the nitrogen bubbles in blood or tissue are going to cause damage. So basically, you have to go into a hyperbaric oxygen chamber to be able to get all of those tissues. Like it's going to intensely get that oxygen into your system. And then you've got carbon monoxide poisoning. So you have a high concentration of carbon monoxide that results in low levels within the body. Just some general blood disorders that you've got: hemochromatosis, so too much iron within the intestines. Leukopenia is your decreased leukocytes so that you can't fight infection. Neutropenia, it'll decrease neutrophils that usually result in or from your cancer treatment. So like your chemo and your radiation therapy. Polycythemia, so you have too many red blood cells, so you are at an increase for blood clot. Thrombocytopenia, small numbers of your platelets. Thrombocytosis, so an increased number of your platelets. And then a hemorrhage, which is just a large amount of blood that's lost in a short amount of time. We already talked a little bit about the types of anemia. So your pernicious anemia, hemolytic, iron deficiency, and then your megaloblastic, that is just where your RBCs or your red blood cells are larger than normal. And then you have your sickle cell, which just means that it has a specific shape, like a sickle shape to it, instead of the like that flat with the little, basically like a donut hole in it. And then your thalassemia, which is a genetic abnormality that causes you to have reduced hemoglobin production. Some of the infectious blood diseases, obviously there's going to be many more than this, but malaria, so you can get it through mosquito bites. Sepsis, which is basically whenever you have an infection into the bloodstream that is bacterial, and it can cause multiple organ system damage. And then septicemia is just the act of it actually entering the bloodstream. So your diagnostic procedures, the easiest way to diagnose anything is just going to be by a blood draw. They'll do it with a venipuncture and then put it into the centrifuge that will then separate it into those different parts that we talked about earlier. So your blood test that you can have done, CBC, which is just a complete blood count. It basically measures your red blood cells, your white blood cells, your platelets, like all of the levels of like your normal potassium and all of that kind of stuff. CMP, which is a comprehensive metabolic panel. There's 14 different tests in there. I can't tell you everything that's in there besides the ones that are here because it's just kind of like a huge overall. BMP, which is a basic metabolic panel. This will just look at like your kidney function and your electrolyte. And then your BUN or your blood urea nitrogen. If it is high, then it indicates your kidney problems. And then your ABGs or your arterial blood gases, those will indicate any lung or kidney disease. ESR is a SED rate. It indicates inflammation within the body. Hematocrit, which will tell you your red blood cell count within the blood. Lipid panels, basically you will fast typically for this so that you can have those levels tested and it will tell you whether or not you've got high, too low. And then your prothrombin time, that just checks for how long it takes for you to clot. A lot of the people that will have this done, I'm not saying that this is the only time you can, but majority of the people that have it done are ones that are on long-term affairs, you're elderly or. And then you can do some urine tests for blood disorders. You can do what's known as a Schilling's test, and it's just going to tell you whether or not you are absorbing B12 vitamins. And then you can have blood or bone marrow biopsies to determine what your your blood counts are for like red blood cells and white blood cells. They will typically do it in the pelvis just because that's where a majority of your red blood transfusion. So essentially, whenever you have to have that blood replaced for whatever reason, you can be allogenic. So it's someone that is the donor, but they are compatible. Autologous is if you know you're having surgery, you can go in and donate your blood a couple of weeks at a time. You can have it stored by previously donating it. Typically, this will happen if you have a very rare blood type or a very rare genetic disorder that only allows you to get certain. And then you can have platelet and transfusions that can help reduce the risk of bleeding or infection, especially in cancer patients. So you can donate blood every 56 days. If you are like me and you are lucky and you have type O, they will call you and they will harass you and they will make sure that you know where you are every 56 days of your life. So it does take 5 units of blood to replace 1 unit of platelets. So platelets need to be used within 5 days. So it's kind of one of those things. That's why we typically will be able to donate blood or donate your platelets every 7 days because they can be replenished a lot faster. Plasma donations are going to involve separating out the whole blood, or they're going to take out whole blood, they're going to put it in a centrifuge, and then they're going to take out the plasma and they'll give you back your red blood cells and your platelets. Where typically whenever I donate, I do the complete opposite. I do a power red is what it's called, is they actually take double the amount of red blood cells and they give me all my plasma back. Therapeutic plasma exchange or a plasmapheresis. So you use your own blood that's circulated through a device to basically act as a kidney or a liver to help remove any disease, and then they'll put it back in. It's going to be pretty similar to your hemodialysis, where it cleans the waste from the bloods with your poor kidney function. Hematopoietic stem cell transplantations. So these are going to treat cancer such as leukemia, multiple myeloma, and then even some lymphoma. You can get it after you have chemo or radiation to see about like killing all of like the unhealthy stuff. But unfortunately, while we kill the unhealthy stuff, we also kill the healthy stuff. So this is where they can do that stem cell transplant to help replenish some of the healthy stuff. And then medications, you have anticoagulants or blood thinners, heparin, which is quicker acting than Coumadin, and it's done by an injection versus having just to take a pill every day. Typically, you will never get heparin out of the hospital just because it can be extremely lethal if you take too much of it. Your anticoagulant agents, so which are your low-dose aspirin. There are people that will take low-dose aspirin every day instead of an anticoagulant until they can no longer put it off. And then your hemostatic gauze products, these are going to be designed to promote your rapid blood coagulation in the event of a traumatic wound. And then you've got your stem cell sources, your graft versus host disease, which is the problems from not matching donor to recipient close enough. And then you've got bone marrow stimulation that can be done with. And then we've got our suffixes for blood, anemia, which is just a general condition, penia, which is going to be a decrease in, and then poesis is going to be that formation or that production. Your word roots, you've got myelo for bone marrow, hemo for blood, erythro for red blood cells, leuco for white blood cells, lympho for lymphocytes, thrombo for a blood clot. So remember when we have that thrombus, it's going to be that blood clot that is moving. Thrombocyto is going to refer to our thrombocytes, and then immuno is for immunity. Most of them will match if they're not ones that we already know, but there's those for you. And then the word root for blood chemistry, this will probably be the one that you'd like. These 7 here will probably be the ones that you need to study more than the others, just because these are not ones that you see very often, besides the oxy, which is your oxygen.